TZ2 of the left hip complex for base running strategies. Again, we've conversed about the everted position of the landscape that is created from the trajectory and the velocity of the body being in this vortex-like force and pressure getting sucked out beyond the confines of the infield, and the position that therefore that places the body in and the joint. So position versus the motion that we get. So motion wise, in terms of our TZ1 position of the left hip, we are experiencing left hip flexion as the femur comes up towards the pelvis, and as the pelvis anteriorly rotates, that is met and coupled with a left lateral translation in the frontal plane. In frontal plane motion, we are going to be in an abducted position because of the angle that we're at. So I'm over exaggerating obviously with the pelvis, but we're going to be running with kind of this tilted like position here, in which the trunk and the center of gravity want to stay upright and over the body's base of support, which are its feet. And because of the velocity that we're moving in the trajectory of our motion, feet are angled kind of back into the base path in the infield. And so we're actually in an abducted position even though we're going through the motion of adduction. So extremely important that we're able to have the stability and the strength that's set off and forth through at transformational zone 1 of the foot and the ankle. In terms of the transverse plane, frontal plane, sagittal plane motion, so that we can control the right lateral flexion of the pelvis, which will give us our adduction at the left hip joint, which is met with an anterior translation on our left and right lateral axes. So transverse plane motion, we're in a position where everything wants to collapse on it. It's important that we are able to control that motion at the right time so that the femur rotates towards the body's midline quicker than the pelvis to give us internal rotation of the left hip joint. Posterior lateral hip joint capsule, gluteal complex, extremely important for being able to properly decelerate and control the motion that's occurring right there. So again, everted with regards to the environment and the surface for the left lower extremity that we're positioned in. Left hip is pre-positioned in an abducted position. So if we have neutral right here, neutral, we have, even if it's just a slight little bit abduction, even if it's a slight little bit adduction, so position versus the motion, we're still getting the same motion, and we have the opportunity in the frontal plane to go through and to gather adduction and load up that left lateral butt and hip complex in the frontal plane, and to use the control in the transverse plane to help facilitate propelling us through TZ1 through into transformational zone 2.